Thank you very much. Well, thank you for inviting us to come and talk to you today. For those of you that don't know Beamish Museum, it's in the northeast of England. Have people heard of it? If not, visited it? Great. And I'm here with my colleague Bruce Davenport from Newcastle University. We're going to talk to you today about two Erasmus-funded projects that I myself at Beamish have been involved with. One that finished in 2014, and we're now halfway through an Erasmus Plus funded one that we're working with Bruce. But for those of you that haven't visited Beamish before or heard of it, it's a very large open-air museum in County Durham. It's about 450 acres, so huge. And it tells the story of the North East from 1820 to 1940. So we have a recreated town, pit village, farm. But the pictures on the right show my little world within Beamish, which is our health and wellbeing work. I've been at the museum for just over 8 years now, but the health and wellbeing work has been for about 5. 2 years ago, we opened Orchard Cottage, which is what you can see in the pictures. And that is a cosy little cottage set in the 1940s, but not explicitly 1940s. But the uniqueness of Beamish means that rather than just talking about how we used to make toast on the fire, we can actually do it. Rather than somebody saying, I used to play the piano, can you show me? Can you teach me how to play? I don't think that was Beethoven, but it could well have been. So that's Beamish, and that's sort of my world at Beamish. So the first Erasmus-funded project was in 2012. This was my first experience, and the museum's first experience of Erasmus-funded. And it was called the Reactive project, and it had 3 strands, focusing around this idea of active ageing, and they were reminiscence, volunteering, and community engagement, but all focusing around older people, not necessarily retired or older people in care homes, but this sense of U3A, that type of groups. The museums involved were ourselves. There was Jamtli, which is an open-air museum in Sweden, Den Gambleby, which is in Denmark, Centendra, which is in Hungary, and Bokrijk, which is in Belgium. So all of varying different sizes. And all the museums were, at the very least, thinking about these things, and some of them were already well on the way to developing them. For example, Den Gambleby have been doing their health and wellbeing work much longer than us at Beamish, so they were at the forefront of that. But volunteering, Beamish, in its 45-year history, has been based on this idea of volunteering. We couldn't be a museum without our volunteers. But to other museums, the concept of volunteering is very new, and it's not really something that they'd started thinking about. But just as a way to show the really, really basic but the most valuable part of this project was this visiting other museums. And for myself, it was a real reassurance in that the picture on the right is a session that I run in our Orchard Cottage with, I think that's a group from a local care home. On the left, that is the same type of session happening in Denmark. And you can see straight away, very similar things, but with those cultural differences. So we have tea and toast, they have coffee and pastries, that type of things. But what all brought us together was this wanting to learn from each other, not just telling each other what we do and that was it, but learning from each other, asking those questions, and looking at developing what we do together. So it was really about sharing our knowledge with each other, experiences and best practice. We did that through primarily visiting each other's museums. There were 3 meetings that took part during the 2 years, one at Beamish, one in Denmark, one in Sweden. And that was a really useful way to physically see each other's museums, get an idea of the similarities, the differences, and to meet the wider staff as well. Because of funding, there are only ever 2 or 3 representatives from each museum at the meetings, but visiting others, you get to meet sort of my equivalent and my team's equivalents. And us at Beamish, we were always very conscious to take our engagers with us. The engagers are the people that wear the costumes at Beamish and talk to visitors on a day-to-day basis. And we were really keen that it was a learning opportunity for them as well, rather than just me coming back and saying, I've been to Sweden and I've learnt this, for them to take ownership of that as well. And to take part in the activities as well. And again, pictures just to show this idea of gardening came up. Gardening is something that we're able to do at Beamish, but in Denmark, they have a 1950s apartment with no outdoor space. But we were talking about the therapeutic benefits of gardening and nature, so that is them adapting that within their space. Another really useful thing was to send updates to each other, and obviously because we only met 2 or 3 times, this was done through regular updates where each museum would send a series of questions, and the following update we would answer them, and it carried on like that. If I'm being really honest, I would say the first couple of meetings were definitely a case of this is our museum, this is what we do, we are great. I'm focusing on the real positives, and we get this many visitors, or we get this many visitors, but which is fine, that's what we all do. But definitely by the end of the project, we were definitely starting to have some more honest conversations. Some of those happened within the formal meetings, but also to touch on what Maria said earlier, is through our directors allowing us to make those friendships and supporting us to make those friendships as well. Actually, sometimes the evening meal after the meetings was where you got to the nitty-gritty type of things, and that was really valuable. So by the end of the Reactive project, we'd all introduced new programs, new projects, new methods of working. For people like Hungary, who were very, very new to this, that was a really big learning opportunity for them. And it emerged that this theme of older adults and working with people with dementia emerged as the key theme and something that we were all really enthusiastic about and wanted to develop further. The volunteers and community work carried on, and for example, we've been mentoring a new volunteer placement at Den Gambleby. And like I said, these honest conversations were so valuable in helping us to think about the next steps. It wouldn't have been a valuable project if we'd just ended and said, yes, we're all great, we don't need to do anything more, we're great, end of. But these honest conversations meant that we started to talk about, right, well, so where are our knowledge gaps? How can we address these together? So the next steps, we're thinking about developing these relationships, because we'd already started to be emailing people outside of the project about new things, sharing. The people in Denmark are really interested in our networks here. For example, the age-friendly network through the British Museum, they're really keen to try and start one in Denmark. We'd recognise one of our big knowledge gaps was in evaluation methods. There wasn't really much evaluation going on in our work other than the informal types. So then we started to think, well, who else could we link up to do this? Which is, I'll let Bruce tell you about that. And this idea of workshops and training for carers and relatives was something that Beamish have been doing for several years, and Denmark had been. And it was something that we recognised was a real key theme that we could develop to sort of contribute to public health in our countries. So the project that we're involved with now, we're about halfway through, is this active ageing and heritage and adult learning. And we hope to be able to contribute to innovations in public health through this collaborative working across other European museums and universities. We are all open-air museums, but we're very keen to create this set of guidelines that can be used across a whole range of museums, whether you're starting or if you're further on the journey. So the guidelines that we hope to produce will not be specific just to open-air museums. And working across 5 countries and 5 large museums means that we create this much larger evidence base for our future funding and commissioning, whether that's on a large international scale or just in our local authorities. And we're going to be contributing to a more skilled and informed health and social care sector. I was at the conference here on Wednesday about museums and health, and the gentleman from Public Health said, you are really starting to make us think a bit more about the impact that museums can have on health and well-being. And he said, I can't promise this is going to change overnight, but keep doing what you're doing, and the more you do, the more this perspective will change. And we're also hoping to develop workshops for relatives of people living with dementia. This is something that I've started doing in the past year to support the communities. So I'm hoping to support the community in Durham, but likewise, Dengambleby are hoping to support the relatives that they're in contact with. So I'll hand over to Bruce, who can tell you a bit more about the current project. Sorry.
So from the evaluation side, we're coming from a variety of perspectives. Myself from sort of museum side, museum studies side, health and care sciences and psychology. So we're trying to mash that all together. And the evaluation has to work. It has to work in 5 countries, and it has to be run by people who aren't researchers. So that sort of sets our framework, if you like. This is where we're at. We've defined the session, we've defined the evaluation protocols, we've set up the data management session, and we're starting to run. So we're just getting the first bits of data in. So I can't tell you what we found, because we haven't found it yet. On the other side, we're working on the course for carers, and that again is in development. So we're very much in process. Invite us back in a year and a half or so, and then we'll be sorted. So what we found so far, which is probably most useful to you, basically the whole issue around health and well-being is about relationships outside the museum. So it's the relationship of the museum to care organisations. And that is an incredibly varied thing. It's very varied across the 5 different countries. And that's what we're finding we're learning about, is how each organisation is relating in a very different way to the care organisations in their environment. The other thing which ties into that is a constructs of well-being, what that means in a different country. It means very different things all across this country. So let's add on another layer of variation when we look across different nationalities. And also linked in with that is about appropriate evidence. Some museums don't need evidence. They just go, we're doing fab stuff, and the funders go, yay, and that's the end of the conversation. Whereas we're having to make a much more formal argument about what data we gather and what it looks like, and quantitative, qualitative, and so on. So these are very big differences we're dealing with. And the other thing that I think we put on, is there a lot of variation in the concepts of, or the conception of the person with dementia and their capacity to give consent, their capacity to engage, and so on. And we see very, very different understandings across 5 nations, and that's shaping the way those museums work, and that's shaping the way we work with each other. So I'm going to stop there. But we'll learn more, and we'll share it as we go along, and there you go. But don't ask us questions.